You're watching A Functional Medicine Approach to Metabolic Syndrome by Dr. Lisa Gall on Resonance Wellness TV, part of the Whole Life Medicine Alleviate series. Keep in the loop about future webinars and events on whole-life-medicine.com. Hello and welcome to A Functional Medicine Approach to Metabolic Syndrome. My name is Dr. Lisa Gall, and I will be your guide about all things metabolic. And as usual, this presentation is given in the context of the whole life medicine model. And that's the model that I use at Resonance Wellness when I'm evaluating your healthcare situation. Today's presentation on metabolic syndrome is really important because you're about to learn that a number of specific problems that patients assume are all different problems are in fact conditions associated with one big problem. And that one big problem has been named metabolic syndrome. In the past, it's also been called Syndrome X, but that kind of fell out of fashion. So it is now called metabolic syndrome. And it's a unifying issue that really illustrates perfectly how the alleviate step of whole life medicine can reverse major health problems with fairly simple solutions. So let's take a look at metabolic syndrome. So we're going to define metabolic syndrome, obviously. You can tell from this slide. So a syndrome is really a group of symptoms that together make a single condition. And of course, there's lots of things that people have heard of in terms of syndromes. But metabolic syndrome in particular is referring to the flow of substances into and through your body that make energy. And we've talked about aspects of the metabolic process in most of our webinars in relationship to all sorts of health problems. So internationally, this syndrome is actually referred to as CHAOS, which stands for coronary artery disease, hypertension, adult onset diabetes, obesity, and stroke. So it's all of these are referring basically to the same disorder. Now, not everybody who has one of these individual symptoms will have the full metabolic syndrome, but it's generally recognized that these things often occur together. And even if you've only seen one of these in your life, chances are good that if one shows up, more than one will show up. So it's not unusual that patients have been recommended to take drugs that control one aspect of the presenting signs of these conditions, right? So blood pressure medication is an example, or cholesterol medication, like a uric acid or gout medication, a blood sugar modifier like metformin, and blood thinners. But in essence, all of those drug interventions are attempts to modify the result of a disordered metabolism affecting multiple body tissues and creating various symptoms across organ systems. So we have talked about this in the past in various lectures, and we keep coming back to these set of things that often occur together. And we often find that they, at their cause, are similar also. So in metabolic syndrome, it's really caused by the interplay of what you've inherited genetically and then lifestyle components. And it always seems to increase in incidence as you get older. Now, it doesn't have to, but just in observation, this is true. So genes play a role in how well you handle influxes of blood sugar. So different populations in the world have differing abilities to handle various kind of foodstuffs. So the risk of metabolic syndrome is actually higher in Asian people, Hispanic people, and Aboriginals, pretty much worldwide. But that doesn't make anybody else on the roster immune. So you can have metabolic syndrome regardless of what your background is. A very significant contributor to metabolic syndrome is having larger amounts of fat tissue in your body, and or, because it's not always the same, weighing too much. So a high starch intake will also make you more prone, as will eating basically any other food that has a high glycemic index. So a high glycemic index, some of you may have seen a chart that lists things by glycemic index. what that means is that, in essence, the higher the glycemic index number, the more quickly it's digested and translates into blood sugar. So in essence, like table sugar, I think is listed at like 100 on the glycemic index. And you'll see kind of down from there various substances, like you'll see a lot of the fruit juices in the top, so a refined version of fruit. You'll see refined wheat up in the top. So it basically ranks things, how quickly you translate that thing into blood sugar. And if you are eating something that translates quickly into blood sugar, but you're genetically not capable of handling that, that's a pretty big stressor on your body. So accompanying a kind of high glycemic index is that a poor fiber intake will contribute to metabolic syndrome. So this makes sense because a lot of these things with high glycemic indexes are, in essence, refined foods. And in a refined food, the thing that mostly is refined out of it is fiber intake. So there are many people in the world also who don't just do a great job of fiber. And I think Canadians on average don't do a great job of fiber because many of the foods that we eat are not particularly high. Another risk factor would be eating damaged fats. So especially the trans fats that you find in commercial baked goods. So people don't think about damaged fats being in muffins, but in reality, that's where most people are going to find them. It's going to be like in a commercial baked good where they're using cheap shortening or cheap oils because they're cheap and it's easy to produce them quickly. And they combine that with starch. So damaged fats plus starch, the muffin, dyad there. Fried foods, obviously also contributing. Frying things produces damaged fats. So damaged fats are basically things that end up having to be treated like toxins to be excreted versus fats to be used well. Now, you wouldn't know this sometimes, like I said, unless you check the label. Make sure there's no partially hydrogenated oils in what you eat. So what partially hydrogenated means is that it was a cheap oil that they changed they chemically changed it to have a different texture. So margarine is a great example of that. Now, not all margarines are made that way. Like, there are some things like Earth Balance as an example. They're not going to have partially hydrogenated fats in them, but some of them cheap commercial ones will. Not eating food with enough micronutrients is also a metabolic syndrome cause. So, kind of along the same lines as eating refined things, if you refine a food or process a food, you often will lose a lot of the micronutrients because they're going to go kind of the same way as the fiber a lot of the time. Another cause would be being sedentary, like this fellow here on the couch. Smoking and drinking will increase metabolic syndrome risk. And stress also. Stress is a factor that contributes because the adrenal gland is responsible for increasing your blood sugar when you're stressed. So weirdly, of course, when people are stressed and tired, they often eat poorly and they don't exercise. So those are some of the things that they end up being kind of circular. And so we think about these as mostly being lifestyle causes. So these are things we really do have a lot of control over, with the with the slight exception of genetics. But even genetics is not a guarantee. Genetics is a set of predispositions, but predispositions do not equate to like a multi-component behavioral problem like this. They just make it more or less likely depending on what you inherited, if that makes sense. So in order to diagnose it, there's kind of like two prongs to this. First of all, you would base it on the result of a physical exam and also blood tests. So there's several risk factors that are shown here on this little diagram. And these are the things that are known as the diagnostic factors for metabolic syndrome. So the first is having a larger waist circumference, especially if you store the weight really around the actual waistline. So in the abdomen, but also above the waistline, so that you actually get a bigger waist. So some people don't carry their weight there. Some people carry all their weight in their butt, or they carry it kind of evenly all over. But you can often tell when people are starting to lose their definition in their body. Of course, that's called the apple shape. And so this is a risk factor for metabolic syndrome. And we're going to talk about this in more detail in a second. The second thing is high triglycerides. So triglycerides are a form of fat. So when when those types of blood fats, it's kind of temporary storage form of fat. It increases in the blood. That's also a sign of metabolic syndrome. The next is having a low, high density lipoprotein cholesterol level. So the HDL cholesterol levels are sometimes called like the quote unquote good cholesterol levels. Good and bad is relative, but it is protective to have a certain amount of HDL in your bloodstream. And so it's actually not so much that you have too much bad cholesterol, it's usually that you don't have enough HDL. Now, chronic hypertension is also an issue. So this is not like episodic hypertension from like running up the stairs. It's like you constantly have hypertension, like high blood pressure above the normal ranges. And we'll talk about what those are in a sec. High fasting blood glucose levels is the last major one. So this can happen even if you're not diabetic. You can have blood glucose levels in the pre-diabetic range. So these are fairly simple things to test out. And of course, you want to take them all together and see whether or not you actually qualify for metabolic syndrome. So there's other risk factors that we can talk about. And like I said before, there are certain populations that tend to have more of a risk than others. But here, I just wanted to put some of this up here, like the obesity statistics here, because this is a Canadian Community Health Survey that basically showed how many people have a BMI of over 30 amongst the various populations by percentage. So it was very significant. So you can see here that in Canada, white people tend to be fatter. They don't always have more metabolic syndrome, but they tend to be fatter. And then it says here in the end, I don't know if you can read that because it's quite small. It says off reserve Aboriginal. So I don't think they had stats for on reserve. I think those are published separately. But you can see various populations. Obesity may not be high, but like I was saying before, Asians tend to have a higher rate of metabolic syndrome, even though their obesity isn't at the highest. So it isn't so much also, like I said, about having to be obese. It can be all of these other factors that are kind of hidden in the background. So although one of the risk factors is an apple body, it doesn't have to be just that. So people who have diabetes will typically already have all the signs of metabolic syndrome that precede or develop alongside of their diabetes. So they don't have to precede it, can be there on the side. Now, there's other people that have an increased risk of metabolic syndrome. People who have a sibling or parent who's diabetic. Pardon me. Women with polycystic ovarian syndrome, which has, it's a hormonal type of insulin resistance combination that often creates fertility problems. And also people who take medicines that cause weight gain or changes in blood pressure or blood cholesterol or blood sugar levels, some of them are actually known to make metabolic syndrome occur. So things like thiazide diuretics. So people who have used Lasix in the past, that's hydrochlorothiazide. Beta blockers increase your risk of metabolic syndrome. Eating too much niacin, that's vitamin B3. The TZD agents, the ones that are ironically the drugs for diabetes, also increase your risk of metabolic syndrome. So they actually make certain aspects of the situation worse. So you are improving some parts of the management of the symptom, but you're not actually fixing the whole thing. And you're making aspects of it worse. I think that's always the most ironic piece, is that you're actually using a drug and making a problem worse. Oral contraceptives can increase your risk of metabolic syndrome. Protease inhibitors, which many of you might not be familiar with, but that is a class of drugs that's used for AIDS. And there's also quite a few antipsychotics and antidepressants and anti-seizure medications that can also increase your risk for metabolic syndrome. So if there is a set of drugs that you're on, you should always take a good gander through the side effect profiles. They're often longer than most people would like to read, but often you'll find information in there about it increasing your risk, and you should have a discussion with the person who prescribed it about what is actually the risk benefit analysis of whether or not you should use a particular drug. Now, metabolic syndrome is incredibly prevalent, not just in Canada, but across the globe. I think the estimate is 1 billion people worldwide would really be able to be diagnosed with metabolic syndrome. So there's really an increased dependency on processed foods and globally an elevated body mass index. So that just contributes, right? Growing diagnosis. According to a 2014 study that was published in Canada, 19.1% of all Canadian adults, that's basically 1 in 5 people, meet that diagnosis. And most people are completely unaware of it. So it, like I said before, steadily rises in an older demographic. So about 40% of the people over 65 will have metabolic syndrome. That's an astonishing number of people who may not even be aware that that's part of what's going on with them, part of what creates some of their symptoms. So there's similar studies that also show a high burden of abdominal obesity and the low HDL and the hypertriglyceridemia amongst people 18 to 49. It's not limited to people over the age of 65. It's already being shown in young adulthood. And unfortunately, also getting more likely in children over time as well. So as a kind of like a consequence of this happening, you're going to see chronic conditions like diabetes and heart disease. It's accounting for about 17% of all healthcare costs in Canada. And tragically, that is linked to 43% of all deaths recorded in Canada. So it's something to really be aware of and keep watching your own labs for. So let's take a look at some of those things that we can look at. So there's common signs of metabolic syndrome that you might be unaware of. And then obviously we have the obvious sign of potentially a visible larger waistline. But there's symptoms of high blood sugar that sometimes will appear. So one of them, those signs, is frequent urination. So if blood sugar levels are super high, the kidneys will try and remove the excess out by filtering it out. And so you basically get more pee. There'll be an increased thirst under those conditions, frequent hunger because you're not handling blood sugar well, fatigue, blurry vision, slow healing of cuts, tingling or numbness or pain in the hands or feet, so signs of peripheral neuropathy, and patches of darker skin. So you'll start to see those in fairly quickly. The next is potential symptoms of high blood pressure, so things like severe headaches or chest pain, dizziness, difficulty breathing, nausea and vomiting, blurred vision, anxiety, confusion, buzzing in your ears, potentially nosebleeds. I don't think that happens that often, but potentially, or abnormal heart rhythms. So you can start to see signs of things that, none of them by themselves are going to be a diagnosis, but put them together and they're starting to create some warning signs. So I said we were going to say these things in more detail. So a large waistline for a woman is basically more than 34.6 inches statistically. That actually is where you start to see an increased risk of metabolic syndrome. And you can see here in this picture, it's kind of giving you a sense of it, like it's right at the waistline where you're measuring. For men, it's a measurement of more than 40 for the average man. And I've also put some centimeters there, although I never think of body measurements in centimeters. I think I'm too old now. I do it all in inches. But these are kind of the dividing lines. So if you already know you're pretty close to that, then it's, again, worth looking at some of the other signs to see if there's potentially some room for improvement. So you can either have a large waistline or, like I said before, you can also have a BMI of greater than 30. So body mass index is basically dividing your body weight by your height. It's not the best excuse me, measure. Sorry, this has been going with my slightly sore throat today. So BMI over 30 is also an issue, but it could be separate, a separate thing. So you either have to qualify by having a large waistline or a BMI over 30. So that's basically abdominal obesity. And, extra fat surrounding the stomach is also a significant risk factor for heart disease compared to extra fat in other parts of your body. So if you have fat arms, it's not as big of a deal as if you have a lot of weight in the abdominal region. It's a specific kind of fat. And often there'll be visceral fat signs. That means the fat that's actually stored around your organs. That's a much higher risk. And this is often the kind of fat that's making your waistline big. Now, blood pressure, people get confused about blood pressure. What do the numbers mean? And what are the actual numbers? So a normal blood pressure is kind of equal to or less than 120 over 80. So the top number, 120, means what's the maximum pressure in the system when your heart is at the height of the beat. So if you think about the wave of blood going down the tube, that is your cardiovascular system vessels, the top of the pumping is actually the top pressure. So the 120 will happen when the pulse comes through, and 80 is the baseline pressure that's always there. So you always have like a bottom pressure. If you didn't have pressure in the system, then you would not get blood flow to all of the places in your body. And then that top number is the pulse pressure change upwards with every pulse. So that's what we're actually measuring, the top and the bottom. So it's high if it's more than 130 over 85, generally speaking. Now, it's not a panic value to be over 100, like 130 over 85. It's just telling you you're slowly getting closer to having some sort of metabolic dysfunction. And I think we've talked about hypertension in the past before when we talked about cardiovascular disease. So you can actually get high blood pressure in part from having vessels full of plaque, because they make that distensibility, that the translation of that waveform down your blood vessel with the extra pulse pressure to be, there's just not as much flexibility. Now, those vessels actually distend to accommodate that pulse pressure. But if they can't be flexible because there's too much plaque in them, then you'll get an elevated blood pressure that's much higher. So often when people report with like pressures of 200 over something, it'll be because, they have the metabolic issues and then they also have some atherosclerosis. Now, high blood sugar levels. There's a couple different ways of measuring this, and many people probably have seen or talked to their physicians about these numbers, but a hemoglobin A1C is basically a measure of how much blood sugar you have on average over the lifespan of your red blood cells. So your red blood cells live about 90 to 120 days, and so they're exposed to the blood glucose in your bloodstream every day, all day long. And so you can measure how much blood sugar you're having average exposure to by how many glucose residues are glued onto your red blood cells. So that's actually what we're measuring with a hemoglobin A1C, is how much blood sugar glycosylated or got glued onto the proteins of your blood cells. So it's a much better measure over a period of time, whereas a fasting glucose will usually just tell you what is it in this moment. And there could be lots of factors to that, but a fasting glucose, it's also going to be dependent on other factors. Depends on how long you fasted, depends on what you ate before. It could, like a whole bunch of different things can have an impact on it. But what you'll see here is that these are where your levels are starting to get to the range where metabolic syndrome is going to be a problem. So a normal number is going to be under 5.7 and 5.6, if that makes sense. Once you started to eke up into this range here, into the top of the range, you're already starting to see risk factors here for metabolic syndrome, even if you don't have diabetes, to be clear, because diabetic rates are going to be higher than this. Now, the high blood triglycerides. So high triglycerides are, like I said before, a type of fat that circulates through your blood. The body makes triglycerides by when it has extra calories. So a lot of extra calories like sugar calories or alcohol calories is a great example in the body turn to triglycerides. So your body stores them in fat cells throughout your body. It's kind of like stocking shelves in a pantry. And in theory, it should be a quick grab energy. Like you should be able to use triglycerides when you need them. You're always supposed to have some triglycerides, but you shouldn't have so many triglycerides that they're basically falling out of your pantry. And so they're needed for health, but the elevation is telling you that the amount of calories that you consume is greater than your nutritional requirements. And so for lots of people, they'll see an elevated triglyceride test. This is abbreviated on your labs TAGs, TAG. Sometimes I don't think it says triglycerides all the way. A lot of the time it'll say TAG. So again, it should be lower than or equal to 1.7 millimoles per liter in an adult. And that's the Canadian measurement, not the American one. So I apologize if anybody on here is from America. And then, like I said, blood HDL cholesterol. So cholesterol, like you already know, is that waxy fat-like substance. You need that in your body for good health. It's similar to triglycerides in a way. It's so if it's unbalanced, it can be harmful. So there are two major groups of cholesterols, the low density LDLs and the high density HDLs. So HDL is really moving cholesterol from the blood vessels and tissue compartment and heading it out for recycling. And the LDL is actually going out towards the tissue compartment. And you need a lot of LDL to make things work in your body. All of your cell membranes have LDL in them. You can't live without that. Now, if though you have less HDL, so you have less things returning than you have, not exactly being pumped out, but the ratio, if the ratio is too low for the amount that you're putting out, then you will actually see that the risk rises. So in women, if you have an HDL lower than 1.3, or in men lower than 1, this becomes an independent risk factor for metabolic syndrome. And there's lots of ways of changing this. You can improve, what fatty acids that you're taking in. You can exercise. There's lots of things that actually change how those things are circulated in your body. Now, you can also do a test called fasting insulin. So often we'll see people do blood glucose and A1C levels. Those are common tests, but you can request to have your fasting insulin level tested. That also helps predict the risk of developing prediabetes and metabolic syndrome. So optimal fasting insulin is less than 8. The ideal would actually be around 4 to 5. No, I didn't write that on this slide. I apologize. But that's testing the actual major hormone that is moving blood sugar around for you. So it is, though, a relatively easy way. Like one of the reasons why we use that waist to height ratio is that it's actually fairly close to predicting your insulin resistance. So that's a set of conditions where you're not as sensitive to insulin anymore. You're not moving the blood sugar appropriately, and that's why it stays high and starts to create all of this other tissue damage. So it's actually like that waist to height ratio is actually a pretty good measure of the risk of like heart attack or stroke or death. So not directly in terms of metabolic syndrome, but like in terms of those outcomes, cardiovascular outcomes. There was a study in 2016 that actually showed that in about 800 reproductive age women, that waist to height ratio is a good predictor of insulin resistance. With or without any other individual like PCOS or hormonal condition. So it should be less than 0.5. Now that seems like depends on, again, on how high or how tall you are. Like 0.5 is considered to be exceptionally risky. So that just elevates your risk of all those cardiovascular outcomes and blood sugar outcomes dramatically. Now, most people in my patient population are not going to meet that waist to height ratio, but as it creeps up, because obviously your height doesn't change, so the only thing changing is your waist, which you can measure. Now, I also encourage you to review your family history because dietary and lifestyle changes obviously can reverse metabolic syndrome. I've definitely seen them reverse metabolic syndrome all the way into the full diabetes. But the first step in evaluating risk is review the genes. So if one of your close relatives has had diabetes or heart disease, you could be at an elevated risk. So you just want to think about testing sooner rather than later under those conditions. And obviously making, reasonable lifestyle changes if you feel like there's a lot of that around you. And, a lot of the time we learn from our families how to eat and how to exercise, how to take care of ourselves. And just because one generation did it badly doesn't always mean that the next generation reviews it in time to make some changes. So some people definitely do that. Others really not. So, and like what I was saying before, where your fat matters. So carrying weight around that middle is an indication of visceral fat. And so visceral fat by itself is a key risk factor for metabolic syndrome, type 2 diabetes, heart disease, and even cancer. There's certain cancers that actually elevate quite a bit with an apple body shape. Now, exercise or physical activity is really anything that gets your body moving. Now, the current recommendations are probably that you need about 150 minutes of moderate physical activity and potentially 2 days of something muscle strengthening every week. So, walking an hour a day, 5 days a week will definitely improve your cholesterol levels and reduce your risk of metabolic syndrome. And strength training will do that as well. Even more intense activities, depending on what it is that you like to do for exercise, really improves blood glucose sensitivity, and it will actually modify insulin levels. And what we see with some of the longest lived people in the world is that this kind of activity isn't necessarily done outside of life, right? It's done as part of life. So it's people walking to work and back, or walking to do a particular activity like grocery shopping. They don't take cars as much. That people who do more physical labor or have to work a little bit harder to feed themselves because they own the animals or have to harvest the thing. Those built-in exercises are actually enough to improve risks tremendously. But the way that we live in Canada and most of the modern world does not include things like that. So unless you're a farmer, and even it could be argued like some farmers, they don't have to do a lot of walking anymore. There's big machines to do all the stuff that used to be done by hand, and people don't work in big crews anymore. They work to just run the machine at certain times of year. So it's not the same as it once was. And if you don't have a mixed farm, you're not walking a lot. But, as you get older, maintaining a garden in the summer and making sure that you walk in the winter, even if you have to use poles and some like those things that grip on the bottom of your shoes to make it safe for you. These are important things to do. Walking where you can to, do something fun, parking a little bit farther away if you can't, not drive a car to where you're going. These things are super important, and they count. It doesn't have to be that you just did the thing in the gym, right? So in essence, you don't want to sit for hours a day. A sedentary lifestyle has really negative health impacts. It's probably about as bad as smoking. So we often sit while working, we sit watching TV, we sit commuting to work, and that definitely has an increased risk for metabolic syndrome. And, you get kind of a chronic subclinical inflammation. So, but if you do actually stress your body a little bit with some physical activity, You will boost antioxidant capacity, you'll induce anti-inflammation, and you'll improve that exercise ability. So exercise is going to regulate those fat and glucose metabolism factors, and it'll improve insulin sensitivity and lower blood pressure. So not enough can be said about doing exercise and doing it consistently over time. Again, I'm sure I'm preaching to the choir here. So you can significantly impact your risk for developing or reversing metabolic syndrome by changing your diet. It's the most powerful intervention you can really do. So I would not necessarily advocating for a vegan diet. I think those diets are very difficult to do well. But incorporating more plants into your diet definitely provides positive benefits. So think about it as more like plant focused, high in veggies and fruits, and getting legumes in there. So those are beans, differing to, some higher essential fatty acid like fishes and seafood, and being careful about, you can use whole grains and seeds, but just don't use them in big honking amounts. And less meat and dairy products, and less sugar, and other kind of sweets. So if you're unfamiliar with the visual dinner guide, that's the dinner guide that we made last year or the year before to show what a dinner plate looks like when you've loaded it properly. And what you'll find on that is that you can see how much plants are actually on that plate. So if you go over to the Facebook group, you should be able to find the link for that. Just search visual dinner guide. Fiber, like I said, people take fiber out, and dietary fiber, though, if you put it in, lowers your risk. So there's lots of things that you can eat, from vegetables to fruits to cereals and grains to beans, depending on which things work best for you, that you can actually improve your risk of metabolic syndrome. Part of it is you're improving digestion. You can reduce blood cholesterol, and you control blood sugar moving from the gut into the blood, in essence, in your digestion. So you're creating better bowel health, you're improving insulin sensitivity. It's basically going to reduce your risk for diabetes. So if you incorporate a whole grain and seed like quinoa, when I mean whole grain, I mean like the wheat berry, not like white bread or even brown bread. Most brown bread is just not really got that much fiber in it. You have to really pack it in there to make it as nice as some of the historic whole grain breads, because they use a lot of dough conditioning and stuff to make it still fluffy. Oats are okay, like steel cut oats, fruits, veggies, beans. Like I said, half your plate with veggies and fruits, and then choose whole grain carbs. So the minimum for fiber intake is about 38 grams a day for men under the age of 50, and then over 50, 30. It sometimes just becomes a little bit harder to handle that much fiber when your digestion slows down a little bit with age. And in women, you want it to be 21 grams when you're over 50, but 25 when you're under. So what does that look like? You can see here I hope you can see this fairly well, but you can see there's some beans here that have like a fairly high amount of fiber in them for a fairly low volume. You could easily eat this much, I'm quite sure. And so as long as you're having combinations of foods that are whole over your day, you'll do a pretty good job of fiber. But many people don't do that great a job of whole foods. Now, the next thing is you got to be mindful about what you drink. So you got to pull out the sugary stuff. That really does spike blood sugar levels, and it also adds unnecessary calories to your diet. What you want to do is drink water because it actually suppresses vasopressin. And that's a hormone that's linked to fructose-induced obesity and diabetes. So there's actually been studies that have shown that an increased water intake is a beneficial way to actually prevent and treat metabolic syndrome. So I know you know of me as kind of the water Nazi, and we have repetitively talked about making sure that you all drink enough water. Well, this is another study that's now showing that it actually can reverse metabolic syndrome. So it's pretty important. And it doesn't take much, as little as about a 5-pound weight loss can positively impact blood pressure and blood sugar, cholesterol, and triglycerides. So you can do that with a few fairly minor lifestyle adjustments. So a major weight loss can actually have very rapid effects on many of the signs of metabolic syndrome. A lot of people who have joined us in the past year and a half for metabolic resets will have experienced this. We've had many individuals who were borderline hypertensive or full on or high cholesterol or diabetic who quickly, when they lost their weight during the resets, completely came to normal on most of these things and dropped a bunch of the drugs that were actually that those people were on for the various different conditions. It makes a huge difference to lose weight. And you can actually join a 5-pound weight challenge. So you should actually get an email in the next week or so that talks about joining a 5-pound challenge. So if you've never done a reset and you want to kind of try your hand at losing 5 pounds to decrease your risk, sometimes you'd be surprised how easy you can do that. You're totally welcome to join. That's going to be a private group for our patient community. On our course platform. So if you don't see that email, check in your spam filter. It will probably be there. So again, we have a couple of planned webinars here for the next year. So this is May is when the webinar year ends. So next month is brain-based wellness. February is deconstructing cravings, and May is the power of plants. You'll also see that we still have one more in the Dr. Mom series. So if you missed healthy snacking, it might be because you didn't realize it was a helping Dr. Mom topic, but we also talked about it for not just kids. And those should be up now on the Alleviate webinar replays. So as per usual, thank you so much. You guys are awesome for showing up, and it means a lot to be able to share this information. I know people are.
Thanks for watching. I love to connect to my patient community to inform and inspire, and I hope you'll join us again in the near future. Don't forget to check out whole-life-medicine.com for more webinars and events.